Great. Good afternoon. Welcome to the Bidders Conference for Childcare Health Consultation Service Delivery for Prenatal to 5 Services for Best Starts for Kids. Thank you all so much for taking the time to join us. I'm Jessica Cafferty. I'm the Program Manager for Childcare Health Consultation for Best Starts for Kids. I will also be joined by Sarah J. Sanford from our evaluation team. Before we get started, I want to just go over a couple quick housekeeping things. I'm going to mute all of the participants for today. You are able to ask questions in the chat box, and we'll go ahead and read those aloud and ask them. And then towards the end, we'll have some time for questions. I'll go ahead and unmute everyone at that time as well. Okay. So we're going to start off with just a little bit of an overview for Best Starts for Kids as an initiative. We'll review some of the key elements of the RFP that you're here to learn a little more about. And then, as I mentioned, we'll have time for Q&A. So again, feel free to ask questions along the way through the chat box, or at the very end, we'll have a chance for you to be unmuted and you can ask questions in that way as well. We anticipate having about an hour together today. During this time, we will go over these 3 items. Even though the last thing I wanted to share is that even though I'll unmute you at the very end, you'll have to unmute yourself on your end as well. Note that as I review the key elements of this RFP, you can follow along in the electronic version as well. I'll go ahead and reference the sections that what we're talking about refer to as well. So for Best Starts for Kids, our vision is really quite straightforward, and it's sort of a brief but also very comprehensive approach. Our vision is that we want to see more babies born healthy, more kids thrive, and more young people grow up to be happy, healthy, and successful adults. It's the most comprehensive approach toward this work in the country, and we're investing about $65 million a year in this work. For Best Starts for Kids, all of our work is grounded in equity and social justice. That's really the foundation that we're coming from. And what that means to us is that we recognize that these persistent inequities exist, especially in King County by race and place. And so even though we have a number of indicators indicating that life is really good in King County, we know that for many folks, things are actually getting worse and threatening the collective prosperity of families in our city and county. So one of the things that we're really trying to do is to invest in organizations that are reflective of and embedded in the communities they serve, as well as those that really recognize the disparities and disproportionalities and the strengths that communities possess in the face of those inequities. So how do we do it? We have 4 main ways that we try to make these changes. So we know that for most of our history, so much of public policy has been really focused on crisis management, punitive measures, and reacting when things have gone badly. So instead, we're sort of taking a promotion and prevention approach. So when we talk about promotion, we mean increasing all of the positive things for kids and families. So those are things like resources, positive relationships, opportunities available. We also focus on prevention. So that's preventing things like chronic and toxic stress, unsafe environments for kiddos, or insufficient opportunities. Our third approach is through early intervention. So when challenges do arise or kids or families have additional areas of need, we want to provide those resources and services as soon as possible. And the last is policy and systems change, and really thinking about how we can build a sustainable change that improves the lives of all kids and families in our county. So really briefly, our allocation of Best Starts funding, again, is about $65 million a year. And those funds are organized in 4 main buckets. So investing early is our prenatal through 5 strategies, and about 50% of our levy investments go to investing early. So you'll see that we have some other prenatal through 5 investments. As you might guess, the RFP that we're reviewing in this conference lives in that bucket. Our structure here with investing early, having such a large percentage of the funding, was guided by deep community involvement. So 2,000 community members directly helped us shape Best Starts approach, and that is sort of where we ended up. So now that we've done a quick review of BSK, let's move into the specific RFP for service delivery, childcare health consultation. So childcare health consultation is a strategy that promotes health and safety for children, for families, and for childcare staff. And it does this by really investing in ensuring healthy and safe childcare environments. This service has been delivered across the country for many years, and specifically by Public Health Seattle King County for over 30 years. And what we're doing through this RFP is we're really expanding that work into community. Our strategy that we're going to go over in the next couple slides is outlined in section 2 of the RFP if you're following along. So there are a few characteristics that we usually see in childcare health consultation. Again, this is in section 2. So childcare health consultation services are typically multidisciplinary. There's often a nurse, a mental health consultant. There may also be nutritionists, community health workers, and other staff members sort of as community experiences need. And they're able to then provide a really broad approach to addressing health and safety concerns and questions. It's a strengths-based strategy, so really focusing on where childcare providers are and helping them grow their areas of strength across a broad range of physical, social, and emotional health needs and concerns. Childcare health consultation is trauma-informed, so really centered in that emphasis on trust and respect and safety, and focused on prioritizing resilience and healing for kids and families. And finally, it's relationship driven. So childcare health consultants provide regular visits, but they also provide as needed and on-demand support to childcare providers. So this RFP is eligible to a number of different types of agencies. Those could include not-for-profit organizations, community-based organizations, tribes and tribal organizations, schools and school districts, public or governmental agencies serving King County, and the last one I want to emphasize is partnerships and collaborations. We know that this work is sort of a niche area with expertise required in health, early learning, all of these different areas, community work, and so we would strongly support partnerships and collaborations that leverage the unique strengths of multiple organizations as well. And as always with, as always with BSK, small nonprofits and community-based organizations are really encouraged to submit proposals. So I'm going to go over a little bit around the investment available. You'll see here we have 2 buckets, and this is really 2 options that applicants can choose to pursue. We have about $1 million allocated for each area with room for a 3.5% increase each year. And the rationale for that is that this work is very staffing heavy, and so we want to build in some funding so that staff can have cost of living adjustments and continue to grow. There are 2 options. There's the public health model, which is framed by the work that's happening at Public Health Seattle King County. And then there's community-informed pilot models as well, and there's about $1 million allocated for each. So first we're going to go over the public health model. Note that each of these models is color-coded. That's true in the RFP as well. So as we discussed before, there's about $1 million allocated for this public health model. The contract period will be for up to 3 years, and that contract will begin on May 1st, 2018. And there's a few important criteria to consider for eligibility. So the first is that this model does rely on a multidisciplinary team. At a minimum, the staffing requirements are a nurse and a mental health consultant, and we expect that those will be augmented based on community need. Team members have to have experience with child and community health, as well as familiarity with WAC requirements and other relevant regulations. This work will follow the best practices of public health programs and requirements of the WAC, and will adhere to standards outlined in Caring for Our Children. That is linked through our RFP, and it's a set of standards outlined by the American Academy of Pediatrics. In terms of funding request limits, we are asking that applicants pursuing this public health model request no less than $200,000 and no more than $750,000 per year. Some examples of services that you could consider would be providing regular visits to childcare sites, as well as that on-demand support that I mentioned earlier. A lot of times that's when providers have more urgent questions that come up. That can happen in person or by phone. Reviewing health policies, immunization records, and health plans for individual children. Supporting developmental screening in the classroom and making referrals. Answering time-sensitive questions and providing resources. As well as providing consultation to staff to really create conducive environments and develop strategies to best support kiddos. We anticipate making about 2 to 4 awards for that public health model. Now we're going to move on to the community-informed pilot models. And so this is really designed to meet some gaps in services. We're hoping that this is an area that we can really learn from community and practices that we don't see through the public health model, as well as reach some folks who are not currently reached through public health. So again, there's about $1 million here, plus a 3.5% increase each year. The contract period is the same, 3 years beginning May 1st. And the funding limits are a little bit different. So because of the pilot nature of this work, we are hoping to fund more organizations initially. And so the funding request limits are $150,000 to $500,000 per year. We anticipate funding 2 to 6 organizations for this work. And some examples that we think could be really compelling would be work like training childcare staff in a train the trainer model so they can really retain that health knowledge. Deploying culturally and linguistically matched community health workers that were supported by a registered nurse. Or using culturally and linguistically appropriate promotoras model to serve family home care providers. So there's a number of different models that could be really interesting. We're really eager to see what comes out of the community. And again, we're anticipating about 2 to 6 awards there. Best Starts for Kids does have a few areas of priority in terms of the organizations that will be funding. As you develop your proposal, we encourage you to think about this set of priorities. And when you review the rating criteria, you'll see these concepts really embedded in there. So we are looking to prioritize communities of color, immigrant and refugees communities, low-income communities, communities with disabilities, and limited English-speaking communities. We are looking to fund populations and communities that are experiencing significant service gaps. So that can look like insufficient services to meet needs, or it can look like services that aren't relevant to the specific community needs. And we're looking again to fund organizations that are connected to and embedded in the community they serve. And to us, what that means is employing staff and leadership that are representative of the community, as well as using really clearly defined processes to seek community input. I'm going to hand it over to my colleague Sarah J. for a few slides about data and evaluation, and then I'll be back to finish up this presentation.
Thanks, Jessica. So I'm going to talk for just a few moments about data and evaluation with respect to this RFP and what you might want to know for your application. So our data and evaluation team has 3 guiding principles, which we hope will reflect how we show up in our work together, which is partnership, collaboration, and accessibility. I'm going to talk a little bit now about using data for your application, and then also just what you need to know at this stage about our evaluation expectations and process. So when you think about submitting your proposal, if you do submit a proposal for this RFP, data can be a great tool for you to use in telling your story about what the needs you hope to address in the community are and what your unique strengths to do so might be. So we recommend 3 steps to thinking that through and finding compelling information that will really highlight what you bring to the table in childcare health consultation. So first, think about identify your story. Again, this can be about the communities you work with and about the assets that you have in your staff, your partners, how you may be embedded in the community. Once you have an idea of what you really want to highlight, think about what kind of information will help make that story convincing. And I'll talk more in a moment about the many different kinds of data that you might consider. Once you have that in mind, then you can set out there to find what you need. There's a lot of data available. I'm going to show you a little bit of it, and it can be overwhelming if you don't know what you're looking for. And that's why we recommend kind of thinking through your story and choosing the data that will help tell your story rather than just going out and trying to find any piece of potentially relevant data to shoehorn into your proposal. So with that in mind, what kinds of data might you want to consider? Of course, people often think of numbers first and foremost, and there are some great data sources for this out there that I'll share with you. If you've been doing childcare health consultation or related work, you might have some of your own numbers that show your reach or your program success in the past, and those are certainly welcome. However, that's not the only kind of data that you might want to use. We also welcome stories, which can be through words. You can consider submitting a photograph or a video if you think it's really special and highlights your value in this area. An example here is when we had an outbreak of lice last month, I knew who to call. My nurse consultant helped me take the steps to stop it from spreading and get our center clean and safe. Her visits are making me feel more empowered and confident in my ability to provide high quality care for all our kids. And you might have stories from your own work, from clients. We do certainly want to remind you to protect the confidentiality of any clients or families that you might mention. Be sure to get a release signed if you're sharing an image. But these kind of stories can really help shed light on what's going on in the community or how you're able to help childcare providers in ways that really illuminate the numbers or sometimes fill in gaps where numbers aren't available. So think broadly about what kind of information will help to tell your story. Now, in the RFP, you'll see that we have listed links for some specific data sources. And I want to be really clear that you're not required to use any or all of those. We put them in there because we want everybody to know what's available, and we want to make it accessible to everybody. You don't need to use them unless you think it will really help your application. But it's a good place to start if you do have a story in mind and if you do have an idea of what kind of data will help you tell your story. So there's demographic data, there's data about childcare that we'll look at in a minute. We have what we call Best Starts for Kids indicators. And then again, of course, there's your own data. Could be numbers, could be stories or images from program work that you've already been doing. So with the Best Starts for Kids indicators, these are high-level community outcomes that we are looking at as really important to show what we're trying to impact through the Best Starts for Kids initiative as a whole. So no one organization or even one strategy will be responsible for impacting them. It's something that many factors influence, but we do think they're the most relevant topics about children's and families' health and well-being in King County. And we're really excited to be able to share data on these. And I want to take a moment to show it to you because sometimes it can be a little bit confusing about how to navigate our website. So we're going to go ahead and take a look at the BSK indicator webpage. My colleague here is pulling it up. And this is some of the links that you will find embedded within the RFP, and I think we're sharing it through the chat box as well. So these are organized through the different investment areas that Jessica mentioned earlier. So looking at this right now, let's go ahead and click on developmental screening. Should be up there in the first half dozen or so. My wonderful colleague is assisting here. Thank you. So this is an example of what our visualizations might look like, and I want to take a moment to walk you through. So hopefully you might be a little bit more comfortable poking around in our data yourself if you're curious. So this map shows King County overall, what % of kids have had access to a developmental screening. And we can see that there's not a huge range across the county, but it does vary a little bit by region. So that summary page, usually it's a map, and if you scroll up a tiny bit, you'll see just a brief description of what it is that we're talking about here, what are we measuring, and a little bit more about what it means. Then if you click on the top, you'll see some different tabs. If you click on the demographics tab, this can be really helpful if you're serving a specific community. And we try to provide as many different kinds of demographic information as we can because we know folks are working in different communities, sometimes small communities. So you can see here we've got race and ethnicity, and if you scroll down, you can see different geographic areas. You can see any difference based on income. Yeah, there's that scroll bar right there. So we've got what region in the county, language, if you're working with communities that have different languages, this might be really helpful. And you can take a look and see that indeed there are some differences in the % of kids that have had access to developmental screening. So that could be, just an example looking at one of our indicators of how to navigate that viz and how you might be able to use that to see what are the needs in the community. If we go back to our indicators page, I want to show you one other way to look at that data. So scrolling down a tiny bit, you can see a search bar that says search indicators, type keyword, and then enter. So let's go ahead and type in child care and see what comes up. And you will see that indeed we have quite a few different measures of child care quality here that I wanted to be sure to point out so that you know that that's there for you as well. So there'll be more time for Q&A. Doesn't look like we're having any questions come up at the moment, but let's go ahead back to the PowerPoint. So some final reminders about data. We value all different kinds of data, including stories. We welcome you to use our data sources, and we put them there so that they're accessible, but you certainly don't need to. You should use whatever data you think will make your proposal compelling, and hopefully you'll feel a little bit more ready to dig around in the data if you do choose to do that. So I'm going to talk a little bit more about evaluation now. This is just a list of our headline and secondary indicators, some of that are most potentially relevant to the child care health consultation work area. This is something that we again see the work of BSK more broadly all moving towards. And then you might be wondering, do I need to write an evaluation plan for my RFP? What might be expected with evaluation efforts? Indeed, you don't actually have to develop an evaluation plan as part of this proposal. We realize that can be a lot of work, and especially, if not everybody's going to get funded, that's a lot of time and planning to put in. We're also working really hard to align our evaluation of different BSK strategies so that we can look at the impact of the initiative as a whole. So while evaluation is really important, you actually don't need to do anything for your application as far as an evaluation plan. If you have something you're really excited about, certainly feel free to mention it, but you don't need to include an evaluation plan. We'll be working together with the organizations that are funded to mutually agree on an evaluation plan at the contracting stage. So at the proposal stage, really nothing you need to worry about including. Just know that evaluation is really important to Best Starts for Kids so that we can see what's working and how we're contributing to community health and well-being in King County. So you need to plan that, you will have some reporting to do around evaluation and plan to work together with us on it. If there are situations where you might already be doing data collection about your work, we'll be trying our best to align that so that we don't have to duplicate your efforts in that regard. But the important thing to know for now is that evaluation is important, and it's something that we'll develop a more specific plan for in the contracting phase. No need to focus on that in your proposal. So with that, I'm going to hand it back to Jessica for some more details about the RFP.
Thanks, Sarah J. Okay, so we're going to go over just a few last items around the RFP. If you want to check out, if you're following along, check out section 9. These are the contractor requirements for organizations that are funded through this RFP. If you are awarded, we will work with you to go through a capacity assessment and an implementation plan. That really informs us and you how we can best award your funds and technical assistance that may be needed to deliver those services. There are also a number of BSK trainings or events that you'll be asked to participate in. Those can include things like learning collaboratives, they may include individual meetings, or they may be professional development opportunities. The last area I want to highlight is integration of Best Starts for Kids priorities. We do have a few areas that we're integrating across all of our investment areas. Those include work like infant and early childhood mental health training and certification, developmental screenings. Typically we use ASQ, although we're really open to using other developmental screenings that may be more culturally appropriate. VROOM, and then incorporation of understanding around toxics and preventing toxics in childcare in the home. So contractors will be asked to integrate those priorities, and we'll really work with you to make sure that that's done in a way that's supportive. The timeline that we're going to go over is in the RFP as well. I want to highlight that there are 3 more bidders conferences. So there's one tomorrow at White Center Library, there's one on February 2nd in Snoqualmie, and then a final one on February 7th in Federal Way. So please do feel free to attend those in person if it would be helpful. The final day to ask King County questions is February 16th. And the final day to request initial technical assistance is February 23rd, although if you're working with a technical assistance provider, they may be able to help you past that date. And that's really just to ensure that we can provide the highest quality of assistance to all applicants. RFP responses are due February 28th and will be rated on March 20th. We'll be announcing selected proposals in mid-April, and contracts are intended to begin on May 1st. The last item that I realized I skipped over is the RFP addenda, and what that really is if we have any questions that come through, we document all of those. That's part of why we ask you to address questions to that CPRES email address, and we make sure then that any questions that are relevant to all applicants get posted on the same place as your RFP. So I'm going to talk a little bit about rating criteria, and this is outlined in the RFP, and we encourage you to really consider these rating criteria as you develop your proposals. The criteria include 2 major components. The first is community needs, fit, and approach. And what that assesses for is how well your organization really understands the needs, strengths, and resources in the community or the focus population you're working with. It assesses whether or not you have a real clear plan for your program and how it will meet the needs of community and really leverage their existing resources. And finally, it assesses expertise and relationship with community. The second component is organizational experience and capacity. And what that assesses for is alignment. So alignment of strategy and mission, as well as experience implementing relevant services or programs. How you think about staffing and training, both to deliver the service and in other relevant professional development. And finally, in relationships with relevant partners and a commitment to collaboration with these groups and with public health. You can find more details in the RFP. In terms of review and appeals, all of these eligible proposals will be reviewed by a panel, and that includes community members, subject matter experts, King County staff, representatives of King County Council, and that all of those folks come together to review it according to the criteria we went over. For appeals, any applicant wishing to appeal this decision has 4 days to do so, and you can see the RFP for that full process. This is in sections 7 and 8 of the RFP. I'm going to chat a little bit about budget. If you're following along, this is in section 9 of the RFP. So in terms of requirements, all applicants are required to submit a completed budget. It's not scored in the same way that the other rating criteria are scored, and we will go over it to finalize it with you if you're awarded. We encourage you to include evaluation costs of up to 10%. As Sarah J. mentioned, that's an area that we really value, and we recognize that it takes time and resources to do that work. So we encourage you to think about what that time and staff cost looks like to you and build that cost in. We also encourage you to include any estimated cost to attend BSK required trainings. So take a look at those contractor requirements and think through what that might look like for your organization. You're also allowed to include administrative costs. You should not have them exceed 12% of your total budget. And then a couple last sort of tips. Be sure to use the budget template that's included in the RFP from the procurement website. And there are a number of formulas in that budget template. They auto-calculate, so please don't alter those formulas. Okay. One other item that I wanted to highlight for you is that we have this great resource of free technical assistance for any interested applicants. We have a number of providers. I think we have 7 or 8 providers, and they offer a wide range of skills, areas of expertise, and language abilities. And that service, again, is being offered at no cost to applicants. So you can request that service from now, from when the RFP is open, up until February 23rd, so 3 business days before the close of the RFP. We do encourage you to reach out to technical assistance providers as early as possible. That really does help them have time to plan and really support any of your requests, but they may be able to accommodate last-minute requests on an as-needed basis. We ask that you contact one TA provider at a time and allow them at least 24 hours to respond before reaching out to someone else. And the last thing we'd say is that we welcome your desire to find a really good fit, culturally, linguistically, and personally. If you've connected with a TA provider and you decide to work with someone else instead, that is absolutely okay. Please just contact the initial TA provider directly to let them know. All right, so again, there are 3 more bidders conferences. If you have questions, you can contact our contracts office. The email address is right here, cpresbsk@kingcounty.gov. That technical assistance support is there for a variety of questions, anything from fit to reviewing applications. You can contact them directly for support. I think that we're sending that through via the chat box, and it's also available in the RFP. In the RFP, there is a glossary of terms that has a number of relevant definitions that may be helpful for your proposal. And then I would just encourage you to complete the checklist to make sure that your proposal is eligible for review. It has all of the items that we'll really be looking for to make sure you can be fully considered. So with that, I'm going to unmute all of you, and we can answer questions. Even though I'm unmuting you, you may have to unmute yourself on your end, so please be sure to do that if you have questions. You can also submit them through the text box, and we'll go ahead and read them aloud. I see that a couple folks are typing questions, so we'll go ahead and wait for those, and we'll read them aloud when they're submitted. And again, if you want to ask questions over the phone or through your computer, just be sure to unmute on your end. Okay, Russ asked, where can one download the budget template? It's not in section 4 or attachment 4. I believe that it's in the procurement website. Chris, can you confirm that?
Yes, it's on the, can you hear me?
Yep, we can hear you.
Yes, it's on the website where the rest of the RFP is posted. I'll send over a link.
Thanks, Chris. So our next question is, do we need to have deeply embedded community partnerships already, or can we use this as a platform to establish those partnerships? Thank you for this question. It's a great one. We are really focused on investing in organizations that do have those community relationships or the ability to build them. So if you look in the RFP, there's a number of criteria around this. And if you're able to demonstrate a strong plan for how you would really build those relationships, that could also be compelling. And I would just make sure that you focus both on the rating criteria and on the focus populations for funding priorities. And Chris just included a link to the procurement website where you can find a link to download that budget template. So it's in the chat box here. Looks like we might have a couple more questions coming in. Okay, I'm just going to give one more minute. Are there any final questions before we end our time together? Okay, great. As questions come up, please feel free to reach out to that email address, cprizbsk@kingcounty.gov. And I highly encourage you to reach out to technical assistance providers. Thank you so much for taking the time to join us today, and please feel free to join us for any of our in-person information sessions if that would be helpful as well. Have a great day.